Diabetes Overview. Types. 1. Type 1 diabetes. An autoimmune condition where the body's immune system attacks insulin-producing beta cells in the pancreas. Usually diagnosed in children and young adults. 2. Type 2 diabetes. The body becomes resistant to insulin or doesn't produce enough insulin. More common in adults, but increasing in children and adolescents due to rising obesity rates. 3. Gestational diabetes. Develops during pregnancy and usually disappears after childbirth. Increases the risk of developing type 2 diabetes later in life. 4. Prediabetes. Blood sugar levels are higher than normal but not yet high enough to be classified as type 2 diabetes. Indicates a high risk of developing type 2 diabetes. Symptoms. Symptoms can vary depending on the type of diabetes and how high your blood sugar is. Common symptoms include 1. General symptoms. Increased thirst and hunger. Frequent urination. Unexplained weight loss. Fatigue. Blurred vision. Slow healing sores or frequent infections. 2. Type 1 diabetes. Rapid onset of symptoms. Nausea and vomiting. Abdominal pain. 3. Type 2 diabetes. Often develops slowly. Darkened skin areas, usually in the armpits and neck, acanthosis nigricans. 4. Gestational diabetes. Often no symptoms. Diagnosed through routine pregnancy screening tests. Causes. The causes of diabetes vary by type. 1. Type 1 diabetes. Autoimmune reaction that destroys insulin-producing beta cells in the pancreas. Genetic predisposition. Possible environmental triggers, for example, viral infections. 2. Type 2 diabetes. Insulin resistance and impaired insulin production. Genetic factors. Lifestyle factors, for example, poor diet, lack of physical activity. Obesity, especially abdominal obesity. 3. Gestational diabetes. Hormonal changes during pregnancy that affect insulin function. Obesity and weight gain during pregnancy. Genetic factors. 4. Prediabetes. Similar risk factors to type 2 diabetes. Genetic predisposition. Lifestyle factors. Treatment. Treatment depends on the type of diabetes and individual needs. 1. Type 1 diabetes. Insulin therapy, injections or insulin pump. Blood sugar monitoring. Healthy diet and regular physical activity. 2. Type 2 diabetes. Lifestyle changes, diet, exercise, weight management. Oral medications, for example, metformin, sulfonylureas. Insulin therapy in some cases. Blood sugar monitoring. 3. Gestational diabetes. Healthy diet and regular physical activity. Blood sugar monitoring. Insulin therapy if needed. 4. Prediabetes. Lifestyle changes to prevent progression to type 2 diabetes. Possible medication, for example, metformin. Prevention. While not all types of diabetes can be prevented, certain measures can reduce the risk, especially for type 2 diabetes and prediabetes. 1. Healthy diet. Choose whole grains, fruits, vegetables, lean proteins, and healthy fats. Limit sugary foods and beverages, refined carbs, and processed foods. 2. Regular physical activity. Aim for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity per week. Include strength training exercises at least twice a week. 3. Weight management. Maintain a healthy weight or lose weight if overweight. Even a small amount of weight loss, 5 to 7% of body weight, can significantly reduce the risk of developing type 2 diabetes. 4. Avoid smoking. Smoking increases the risk of diabetes and cardiovascular diseases. 5. Regular health screenings. Get regular checkups and screenings for blood sugar levels, especially if you have risk factors such as obesity, a family history of diabetes, or a history of gestational diabetes. 6. Managing blood pressure and cholesterol. Keep blood pressure and cholesterol levels under control through diet, exercise, and medication if necessary. 7. Limit alcohol intake. Drink alcohol in moderation, if at all. Conclusion: diabetes is a chronic condition with various types, each having distinct causes, symptoms, and treatments. Effective management and prevention rely on lifestyle changes, regular monitoring, and medical interventions. Early detection and consistent care are crucial in minimizing complications and improving quality of life in individuals with diabetes. Thanks for watching the video. If you find the video informative, please provide the feedback in the comment box, click the like icon and subscribe the channel.